Right, so let's start with what we did last session, because you weren't here last session, okay? We looked at those, we introduced the idea of the four pillars. When you have a situation where two or more of these are in conflict with each other, you have an ethical dilemma. We looked at autonomy, which is to do with the freedom of the patient being able to choose for their own treatments or choose whether or not they go ahead with a treatment, as long as in accordance they understand what's involved, right?
Yeah, they have they have the mental capability of being able to make that decision.
Exactly. Or if they're old enough, cognitively able to, if they're old, because children cannot
They're
make
not allowed
that. And so there's an element of law being looked at between the two as well. Like sometimes, like legally, somebody may not be deemed as able to make up their own decision, even though they might be going to be a medical student in a year's time, which is kind of ironic, isn't it? Somebody that's under 18 or, right? So you've got like an element of law as well as kind of, there's a crossover between like what the law says, but what really common sense says as well, right?
Yeah.
But the law has to be held, right?
Yeah.
So you've got autonomy there. Then you've got beneficence, which is what's the best beneficial situation for the patient.
Yeah.
Okay? So as a healthcare worker, you want to do good for the patients, okay? With the healthcare that you're giving and providing. So now we've got two new ones here now. We've got non-maleficence and justice, okay?
Yeah.
So with the non-maleficence, you see in the left, what do you think that means, non-maleficence?
So what is it called? Every treatment has a side effect, and gotta kind of weigh the percent that this treatment, like the chances of this treatment being successful, and also looking at the side effects, because let's say if there are two different diagnoses,
Yep.
and one of the treatments for the diagnosis can hurt you a lot. If it's the other one, then you have to make sure to see if it's the best decision.
Okay.
Not.
Yeah. So basically, it's about
ethics, kind of.
Okay. Here's how I remember non-maleficence: malice, harm.
Yeah.
Okay, just in terms of the word. So every healthcare profession will have the duty to have considered not doing harm. Okay, non-maleficence. It's their duty to first do no harm. So in the bottom left of in the bottom left of this video, you won't be able to see "do no harm" at the bottom because it's been cut off by the video. But it says it has long been considered to be part of a doctor's duty of first do no harm. The video doesn't pick that up, so that's for the sake of the video. I'm saying that. So this is a counterbalance to beneficence, which is you have to do what's right for the patient. But all types of healthcare treatment may have on a scale, have some kind of level of harm that it does. So for example, if you take aspirin, for example, for a headache, all right, there is the danger of the side effect of your stomach bleeding, internal lining of your stomach bleeding slightly. But then it's up to the doctor to then make a decision, or the person, obviously, because there's no prescription required, it's up to the actual patient itself to make the autonomous decision that is the stomach internal, the risk of the internal lining of the stomach to be to bleed more beneficial, a little less, too much malice or harm relative to the benefit of having no headache.
I see, yeah.
Right? So that's it on a small level scale, right? But then surgery. If we were to say we are never doing no harm to no patient ever, then things like surgical procedures wouldn't happen, because you have to make an incision and cut into the person's body in order to then do any kind of intrusive operation, right?
Yeah.
So that incision could be argued that there is harm to the patient being given, right? Yeah. But then, as you were saying, that balance, the counterbalance, is the benefit that patient is going to have far outweighing the incision that the doctor has to, or the surgeon has to make in order to perform the operation, right? So there's always that counterbalance between non-maleficence and beneficence, really, right? It can always be argued this can cause a level of harm. You just want to kind of judge what end of the spectrum is that or that maleficence giving that patient.
Yeah.
Is it, at the point where it shouldn't be considered because the benefit isn't being outweighed? So it's a counterbalance to beneficence. All treatments in some way can cause harm. The benefits of certain actions should be balanced against the amount of harm it can do. It's long been considered to be part of a doctor's duty of first do no harm. Okay? That's non-maleficence. In a minute, we'll see a video on this.
Yeah.
Right. Justice. Justice is, well, what do you think justice is as a word? What does it mean?
Well, I mean,
like, how is justice, like, for example, different to ethics?
Yeah, justice would basically be treating the patient the same way you would, so treating all the patients equally. Yeah. So a great example, which I did fail the test on it, was if you'd have a convict, I think, and then you'd have mom. Which one would you choose? There wouldn't have to be a specific case because you cannot judge the patient's background. You just got to make sure you.
So
do you know which one I mean?
Yeah. So you have a convict, and then you have someone who's a mother.
Yeah.
Who do I use the resources on?
Yeah.
Right. Who do I make the choice for? Right. That's an ethical dilemma, really, if you've only got enough resources for one.
Yeah.
But justice needs to be served because justice is basically avoiding discrimination based on any kind of factor.
Okay, yeah.
Okay?
Exactly.
So if you're making a discriminatory choice due to you feeling that somebody else's life decisions have been better than somebody else's life decisions, that's discriminating against what your subjective idea is.
Yeah.
Right? So making sure that equity is there in a decision-making process. However, then making that decision based on other factors comes into play, which gets a little bit more confusing. Where should resources be moved on? There's something called QALYs, quality of life years, that can come into play in making that decision. But that's something that we'll look into when we look at the medical ethics of coronavirus. And so I've got a presentation on that, which we will do once we've gone through the 4 pillars. Okay.
Ethics is defined by the ADA as the combination of 5 basic principles. These 5 are 1. Patient autonomy, 2. Non-maleficence, 3. Beneficence, 4. Justice, and 5. Veracity.
So there's an additional one there, veracity, but we look at 4 pillars. Okay.
Non-maleficence is the idea of no harm. This means that the dentist must keep their education up to date, will seek consultation and referrals when necessary, have qualified auxiliary personnel, and will not practice when impaired. To give an example of these concepts, we will follow the life of Dr. Jones. 2 years ago, Dr. Jones had it all. He had a beautiful wife, 2 perfect children, and his practice was flourishing. But things took a turn for the worse when last year his parents passed away, his wife divorced him, taking all of his money and his kids. And to get through the days, he has become increasingly dependent on alcohol. Today, a patient came in complaining of pain in her lower right quadrant. Rather than diagnosing the patient and coming up with a treatment plan, Dr. Jones asked his dental assistant to talk to the patient and find out what's wrong. The assistant determines that the patient probably needs a root canal for tooth number 30. Although Dr. Jones has not done a root canal since dental school, he decides that he will perform the treatment anyways, because he's been struggling to make ends meet after his wife took his money. He has had a few drinks already, but doesn't think twice about performing the procedure that day. So what's wrong with this scenario? First, Dr. Jones asked his dental assistant to evaluate the patient. The dental assistant has not gone to dental school and is unqualified to make any form of assessment on the patient. Dr. Jones should have been the one to meet with the patient to determine a diagnosis and treatment plan. Second, Dr. Jones has not kept his education on root canals up to date and should have referred his patient to either another dentist who does root canals or an endodontist. He especially should not have taken the case purely to make money off of the patient. Third, Dr. Jones should not be practicing under the influence of any kind of controlled substance, including alcohol. Just like drinking and driving, this is illegal, unethical, and dangerous for the patient, and would result in Dr. Jones losing his practicing license. By allowing the scenario we just talked about to happen, Dr. Jones is harming the patient and in direct violation of the ethical principle of non-maleficence. So what have we learned? Non-maleficence is the dentist's duty to refrain from harming the patient. They can do this by keeping their education up to date, seeking consultation, and giving referrals when appropriate. Having auxiliary personnel that only performs duties they are qualified to do, supervising all patient care from beginning to end, and not practicing under personal impairment. Dentists are expected to hold high ethical standards in order to ensure that their patients' health and benefit is the number one priority. Thanks for watching. We hope you learned a little bit more about ethics and non-maleficence today.
That was very clear in terms of what the issues were, and from that we've learnt a whole range of things on how not to be maleficent, in effect, right? Education, keeping it up to date when you're practicing, to make sure that only people who are qualified to perform certain tasks do so. Taking patient history, that's the role of the doctor to do, for example. Not being impaired, it's obvious, isn't it? Not trying to perform a procedure for only monetary gain as well. That's not something that should be happening if you have an ethical healthcare provider. And can you remember the other one?
I mean, what is it called? Also, to not harm, education, consultation.
Consultation. If you are not in the situation that you feel that you can perform it, you can refer it on or take a consultation. So that ties in with the education, doesn't it?
Yeah.
As well as the impairment. So irrelevant on whether or not you can sympathise with the healthcare provider, the dentist, right?
Yeah.
Whether or not there's reasoning behind why he has decided to do this, or drink just to get by, that doesn't matter, right? So he might justify it of, I'm going through a difficult time and so on, and I need the money and so on. That goes against ethics. Doesn't matter what the person is going through, they have a duty not to behave in a certain way. That could possibly cause harm to the patient. Now, why can not keeping your education up to date cause harm?
Because there are advancements in medicine all the time, and if you do not keep on practicing, if you do not keep on updating yourself with the practices, then eventually you might forget something, and that might lead. Yeah,
you may not still have the skill. You can forget things. It's something that you may not realise yet at your stage of life, but after a certain amount of time, your skill set, it slowly will deteriorate unless you're not practicing it, right?
Yeah.
So if you haven't done a deep root canal, for example, since you don't know how old this guy is, right?
Yeah.
But it could have been a significant amount of time since dentistry school. It needs that there are reasons why accreditations are based upon time and need to be renewed in order to update skills, okay? As well as knowledge, as well as you say, new technologies and enhancement and so on. So that can cause harm because you've forgotten to do something which can cause them harm. But also somebody else performing the task that is not qualified to do so. Can you see issues with that?
Yeah, I mean, they have not been trained to look for the they have not been trained properly to identify the symptoms and correctly take the patient's history.
Mm-hmm. So they might miscalculate something
yeah.
or give incorrect information to be passed on that then affects a decision that's taken by the healthcare provider. So that's important. And then can you see why not referring on can be an issue when you're not in right mind to perform? Okay, so we've got another scenario here for non-maleficence.
Non-maleficence is a principle that expresses the concept that professionals have a duty to protect the patient from harm. Under this principle, the dentist's primary obligations include keeping knowledge and skills current, knowing one's own limitations and when to refer to a specialist or other professional, and knowing when and under what circumstances delegation of patient care to auxiliaries is appropriate. Without further ado, let's jump into our scenario. Your patient Taylor is a 12-year-old girl who competes in beauty pageants. Her mother strongly wants you to do full veneers on her daughter to cover up her healthy but slightly discolored anterior teeth. You know that this is not a medically necessary procedure and could actually be harmful to the child. There's Taylor. You explain this to the mother, but she responds that she is the guardian and gets to decide what gets done to her daughter, and that you are just a clinician who is paid to do the work. What would you do? Do the treatment as requested. After all, it's their mouth. Do the requested treatment only after the mother signs a waiver. Refuse to perform treatment entirely under these conditions.
So what would you do if you were in that situation? What do you think you need to be doing?
Form as a child, and what is called the veneers are not necessary, so there's no benefit from it. There's only harm coming.
Right. So you then introduce the idea of beneficence against non-maleficence. There's not enough benefit to give the harm. Okay. So then refuse to on those grounds. Not enough benefit given. Very good.
Perform treatment entirely under these conditions. Which ADA principles of ethics are at play in this situation?
Autonomy.
1. Patient autonomy. 2.
Non-maleficence.
3. Beneficence.
A little bit of
4.
beneficence as well.
Justice. 5. Veracity. And remember, it can be multiple.
Now, I am just going to go on to justice. Okay, we'll do another video.
Yeah.
See how far this video is. And then we'll go on to wrapping it up with justice here. And then we'll call it a day.
Justice. Justice, for many people, refers to fairness. But while justice is important to almost everyone, it means different things to different groups. For instance, social justice is the notion that everyone deserves equal economic, political, and social opportunities, irrespective of race, gender, or religion. Distributive justice refers to the equitable allocation of assets in society. Environmental justice is the fair treatment of all people with regard to environmental burdens and benefits.
Hello?
Restorative or corrective justice seeks to make whole those who have suffered unfairly. Retributive justice seeks to punish wrongdoers objectively and proportionately. And procedural justice refers to implementing legal decisions in accordance with fair and unbiased processes.
Hey, how are you?
Justice is one of the most important moral values in the spheres of law and politics. Legal and political systems that maintain law and order are desirable, but they cannot accomplish either unless they also achieve justice.
Justice is served in medical situations when societal impacts with regards to the distribution of resources in healthcare. It is just when everyone have equal access, for example, medicine and services. The overall positive outcome to society in respect to the health of the population and groups within the population occurs. So that's to do with health policies as well, and making sure that all resources that are needed are kind of out there and available to each person. So managing this is actually quite challenging. So there's a constant ethical issue where governmental bodies are constantly in play, where they're constantly trying to ensure that healthcare justice is met across a population in which they serve. So here is something to go away and consider, and then come back to answer after this session for next session.
Yep.
So I'll be taking answers next session. Okay, so discuss them, write about what do we need to consider in respect to justice in the coronavirus outbreak in China. Now, it's a little bit old presentation. It's not a current outbreak.
Yeah.
Oh, well, I guess it still is really. Okay, so what do we need to consider to justice with the virus outbreak, the COVID-19? And are there wider impacts in respect to the world's population health related to that? And then that will bring us nicely on to my COVID-19 ethical presentation, which comes on, where we look at all 4 ethics in respect to the coronavirus. Okay? And just a quick reminder, medical ethics dilemma usually arises when 2 or more of the pillars of medical ethics are in conflict with each other. For example, in the case of voluntary euthanasia, which we dealt with last week, there is a conflict between the patient's autonomy, their wishes to choose when and how to end their life, and the doctor's duty to do no harm.
Yeah, definitely.
And then here is a classic ethical dilemma.
The basic premise is that there is a runaway trolley barreling down the railway tracks. Ahead on the tracks there are 5 people, tied up and unable to move. The trolley is headed straight for them. You are standing some distance off in the train yard, next to a lever. If you pull this lever, the trolley will switch to a different set of tracks. However, you notice that there is one person tied up on the side track. You have 2 options. 1, do nothing, and the trolley kills 5 people on the main track. 2, pull the lever, diverting the trolley onto the side track, where it will kill 1 person. What would you do? The majority of people will pull the lever. In an alternate version of this problem, you are standing on a bridge under which the trolley will pass. You can stop it by putting something very heavy in front of it. As it happens, there is a very overweight man next to you. Your only way to stop the trolley is to push him over the bridge and onto the track, killing him to save the 5. Would you push the man off the bridge? In this version, the majority of people will not push the man onto the railway track. Ethical theories do not always provide all the answers, and ambiguity as to the correct course of action may still exist. For different people, the correct course of action can be very different. This is why we have moved to a system which is patient-centered. Ethically, we must always assess the manner in which we achieve our goals, actions, as well as what our goals are, the outcomes. The 2 are intrinsically linked, but what we must always be clear about is our intentions. These must always be pure and clear of confounders. The doctrine of double effect is used in end-of-life care to justify doctors prescribing pain-relieving medication that may have the consequence of shortening the patient's life. Aiming to relieve suffering is morally good, but can have a morally bad side effect. This is acceptable only when relief of the suffering cannot be achieved in any other way. The good effect must come first and be the primary intention of the treatment. To recap, ethical theories do not provide us with a magical algorithm to come up with a single correct answer. They provide us with a framework to reason out our decisions. Religion and culture also help provide such a framework. Whatever our choices are, we must take responsibility for our actions, be they passive or active, and their outcome.
That will do for today. Thank you very much, and I will see you the next time it's popped up into your calendar.
Yeah?
Yeah? After the holidays, all right? So have a good break, have a good Easter holidays, and look forward to seeing you next time.
Yeah, thank you.
Cool.